you're a very special patient of mine because you're one of two patients that I videotaped entire surgery from the beginning to the end for fusion that we did for you, and the entire surgery was less than about 40 minutes. And the surgery just was 1 month ago.
Yes.
Now, I got your permission, to get the video, but I'm as well getting your, permission. I'd like to get your permission to use the video and this testimonial together, so our colleagues can make a connection between the surgery and the outcome.
Yes.
Would that be all right?
Yes.
Well, what were your symptoms before the surgery?
Severe pain in the spine, low back.
Mm-hmm.
It radiated into my left and right butt cheeks.
Can you show me exactly where did the pain go?
Yeah, it was all the way
Mm-hmm.
across here,
Yeah.
and kind of like down into this area.
And then let's explain as well the leg pain that you had before the surgery.
Prior to surgery, I
Yes.
had numbness in my left
Mm-hmm.
foot, basically. My first 3 toes were numb.
Yeah, and then you said as well you had a pain that was going down the leg.
Hip to foot.
Hip to foot.
Yes.
1 to 10. What did you tell me what
It
that
was
pain
20.
was? 20. 1 to 10 it was 20.
Yes.
Now the surgery was just about 1 month ago.
Yes.
And how is that pain that was going down the leg?
This is better.
Tell me about it.
I have maybe a 1 or so sometimes in the back of my calf.
But some of the numbness still there.
Some of the numbness, about half of my foot, probably from here to toes is numb yet.
Yeah, okay. So meaning that, the sharp pain mostly went away.
Yes.
The numbness is getting better that you had before the surgery. But I'm assuming certain activity is still painful.
Yeah, it's like if this leg feels weaker.
Okay.
Like, so if I'm walking or something, I can tell that this leg feels weaker.
Okay. And I checked it. It is a little weaker, not what we call 4+. Your tibialis anterior hamstring is 4+. But considering that you had those symptoms for a very long time, and all the nerves were irritated, you're really at par with what we expect to see 1 month after the surgery.
Yeah.
Now, you stayed much longer than my average patient in the hospital. You stayed 2 nighs, because most of my patients go home same day or next day. But this is actually extremely fast for somebody who got a fusion, because most of patients after open old-fashioned surgery, it takes them 2 days for them even to walk. Whereas, when after the surgery did you walk?
I was not able to get up same day of surgery, but I was up that next morning about 6:30.
Yeah, so practically less than a day after the surgery.
Still less than 24 hours.
Yeah,
yes.
And that our study shows our patient ambulate within the first 24 hours after surgery, 96% of them, whereas after open old-fashioned surgery, most of studies show that people need more than 2 days before they can even independently walk. So we're still ahead of the curve, and this is what we did. I'm just going to turn around, and we did a 1-level fusion in 40 minutes. Actually, at the time of the surgery, skin to skin was even a little shorter. We put 4 screws, 1 spacer, and overall, I think we are on the right path. And we will put the entire surgery actually online, so for you to look at it yourself as well. Overall, so far, happy with the result?
Yes. Yeah. It's a slow and steady progress.
Yeah.
But I feel very optimistic.
Yeah.
It's been a long road.
I know it is. And no, the only way, I'm happy you didn't have open surgery, so you cannot really compare it.
Right.
But if you go online and listen to other patients who have gotten an open old-fashioned surgery, it's usually much longer recovery, because we caused way too much or way more damage on the way of getting the surgery done.
Right.
So, and even 2 nights in the hospital, and within a month, the hardware is in excellent position and bones start to grow, and the radiculopathy or pain in the leg is mostly gone. That is a very good result for this kind of surgery that it is. It's a fusion.
Yes.
Any other question or comment?
No, I'm thankful.
Thank you.
To you for doing this for
Thank
me.
you.
So I'm hoping we're one and done. So
We'll work on it. Okay. Well, thank you so much for the interview. I appreciate it.